What's up, everybody? Welcome to the Thinking CAAP. So excited to be here with our guests. And of course, before we kick off officially the episode, Heather Holloway, my co-host from Holloway Media Services. What's up, Heather?
Oh, everything's up, Beck. Thank you so much. So thrilled to be here. I love that we have a little forced screen here. It's like, I don't know, like we're playing video games or something. I love it.
I know. I'm excited. We have some really amazing guests. Welcome to Rachelle Abbott. Rachelle is a third-time guest, I believe, officially on the podcast. So this is old hat for her. She's an expert. Yeah. I could leave and she could do this, but she is the president and CEO of Step Inc., Chief Banana in charge there. Rachelle, so nice to see you again.
So glad to be here. Thank you so much for having me again. The last two times were just amazing, so I had to come back, right?
It's true.
Nice.
Well, and so I learned in our kind of a little bit of a prep call before. I mean, if our listeners had listened to your prior episode, they know that you've had a little bit of a stint in radio at some point, and as did Meghann. So, you know, I'm the odd man out here in terms of radio experience. So.
One of these things is not like the other, Beck. We're going to have to switch careers.
I guess so. If anybody's hiring, looking for a radio job.
Good luck.
I know, right? I have a friend that works in radio. And of course, then Meghann McBryan, our other guest today, special projects coordinator at Step, right, Meghann? That's your title?
Hi, I'm happy to be here. I'm excited. Thank you for having us.
Of course. So really excited to talk about a project that you all have been running with, a part of, growing, all the things. I know that it's created, some energy on a state level, and excited to talk about it and really share some innovation that you all are providing. So want to jump into it right away so that we honor everybody's time. But before I ask my first question, I want to kind of talk a little bit with you, Rachelle, about one of the backbones of community action. And if you've listened before, to our listeners, we talked a little bit about community needs assessment as a part of the kind of the secret sauce of community action in, I think, episode 7 with Jen Wintermeyer, who is the Tri-County Community Action Executive Director, and in some previous episodes as well, is that's one of the requirements of what community action does, right? Every 3 years, we've got to do community needs assessments. Understanding deep local need is a part of what our agencies do really, really well. But the other cornerstone here is something that I know is near and dear to your heart, Rachelle, which is continuous improvement. And I think this project really reflects the marriage of those two things. And so when we talk about continuous improvement and the requirement of that within community action, there's a couple things I'll point out. One, that our boards of our organizations and our staff of our organizations are required to go through that training on a fairly regular basis. What that training looks like is a little bit different from state to state, but ultimately it's a requirement. And those organizations who do this really well then embed the continuous improvement aspects in everything that they do, right? From a management perspective, from a process perspective. And so I really see, again, these two things coming to life within the scope of this project. Can you start at a little bit at the beginning, Rachelle, to kick us off about kind of that and how did you discover this idea and how it really was born with life, if you will?
The origin story.
The Batman story.
Right?
Yes,
is that right? Is that good?
Yes.
So right on, Beck, like as a community action agency, the needs assessment is really foundational to who and what we are. And our needs assessment since I've been here, which is right around 15 years, has been illustrating that childcare and early care and education is an area of need. In terms of location, we're kind of central Pennsylvania, so a little bit rural. We do have some urban centers, but they're very small urban centers with Williamsport and Lock Haven. And we are really a childcare desert. We don't have enough slots in childcare to accommodate the number of children to go into those slots. And so year after year, when we were doing these assessments, it just kept saying, the staffing issues, the childcare issues, and not having enough slots. So the capacity issues were all very evident, right? And so that is something that with the Early Learning Resource Center, which is actually a part of a program under the STEP umbrella, we were kind of researching and thinking about what can we do to kind of look at affecting this need. And definitely want to give a shout out to Melissa Kirshner, the ELRC director, because it was really one of the things in our conversation. She was like, I've heard that there's these substitute aid pools, and maybe that would be helpful for staffing. And so that is really kind of where it started. And I'm a planner, as you know, and not just a planner, but a go-getter. So, I took that idea.
Finder.
Yes, a solution finder, a fixer, all things. And so really kind of took that idea and then ran with it. And it happened to be during a time frame where the county was actually looking for possible program opportunities for the ARPA dollars. We had just kind of released, based on the data as well, kind of a state of childcare within the counties, which was kind of a more deep dive from the community needs assessment. So the community needs assessment identified this need and this gap, and then the state of childcare, the Early Learning Resource Center kind of dug deeper into, did some surveys, did some research, and we presented that to the community. One of the rolling pieces of it was kind of thinking about how we can develop and move forward with the substitute aid pool. I definitely know that there was conversations about ones kind of around in Pennsylvania and other ones. So we kind of wrote it up the best that we could figure. And then it took about 3.5 years. Yes, 3.5 years to get the funding through the County of Lycoming. We are very grateful for the funding that came through the ARPA dollars, because really that is what has allowed us to be able to move this program forward. And so the ARPA dollars came in, and the first thing we said was we needed somebody really with that project management skills to be able to move it forward. And so that's how we were able to bring on Meghann to really kind of focus on the operationalization of that. But really the origins came from looking at that gap, doing more research in terms of that state of childcare, and then understanding what a potential solution could be, and then really kind of continuing to bug the funders until we actually got the money to be able to make this happen. And then really kind of thinking long term in terms of strategy.
Yeah. So I want to unbox all of what you just said quite a bit. So I think want to just point out, we're going to get to the funding side in a little while when we talk through some more questions. But I think one of the things that I just want to make sure to say there that you just said that is top of mind for me right now, sitting on a couple boards and also just kind of given the State of the Union. At the time that we're recording this, we're still sitting in a state budget impasse. And so dollars are particularly scarce on top of then, the national concerns and issues with respect to all of the dollars and federal funding that many of our human services providers receive in the state of Pennsylvania. And so what that means, right, is that funding is scarce and hard, and people are having to make really hard decisions right now. Hopefully by the time this episode airs, we're out of the state budget impasse and we have some news on the federal budget side. But what you said there with respect to the funding is that you continue to bug, right, the county. And so ARPA funds, for a reminder for our listeners, if you're not familiar, American Rescue Plan Act dollars that were sort of a COVID response, right, influx of cash in our local communities for county, state, government, right, to try to figure out solutions on some of the problems that were happening from a COVID response perspective. But a lot of times what we find in funding environment, and I'm going to harp on this for just a minute. That's not the purpose of the episode, but I'll harp on this for just a minute, is that we get a yes, and then we don't get the follow-up that we need. And so then we might let that slip through the cracks. But when you see the interest, right, you've got to jump on it. And you've got to continue to ask and don't give up. And 3 years is a long time, but ultimately that got you the funding to do this really innovative project that is now creating real community solution. And that took energy and time. So don't lose hope, right?
Yes. Don't lose hope.
Yeah. Just want to make sure to say that out loud. So
really quickly, Beck, I'll say, as the marketer that's running a business and not in a community action organization, the fortune is in the follow-up, even if that follow-up takes 3 years. So stay pesky, right? But the fortune would follow. Yeah.
Yeah, and I think the key of it too was that childcare was a area so impacted during the COVID pandemic, with our childcare workers being essential workers, and many of them like leaving their families to keep childcare facilities open. And so that direct connection with those ARPA dollars made total sense, right? And so the industry of childcare has not rebounded. We lost a lot of centers along the way, and so this is just kind of one piece in this like larger picture, right, of where we're at in terms of the state of childcare right now and early learning.
So I want to back up a little bit into some of the data pieces that you talked about and talk about the childhood educational needs information that's on your website. So if folks are interested, stepcorp.org. So step, STEPCORP.org. You can go there, look at the part of the website that speaks to the substitute teacher pool, and specifically this kind of flyer, right, about the data. Can you talk a little bit about, and this is for either one of you, Meghann or Rachelle, some of the data with respect to kind of that childcare slots for people who may not really understand what that means, right? And I know it kind of sounds simplistic to us, but I was talking to Meghann, right? Like sometimes we have the curse of knowledge inside. And so want to help people understand some context for, right? Like when we look at the number of spots that we're losing, what that really means, and kind of unpack that a little bit.
Do you want me to go, Meghann, or you got this?
Yeah, go ahead. And then I'll touch on that too.
And so I think each childcare is basically licensed for a certain number of slots, yet they can only run at the capacity of which they have the ratio of staff at. And I think that is something really key to understand, because you could have a facility that may be licensed for 100 kiddos, right? But they only have enough staff to have 80 or 60. And so you're already down that capacity within that. In addition, within the last several years, we've had a lot of places close, retire, with no real replacement of new childcares into those. And so not only do you have the childcares and early learning centers not running at their license capacity, right, because of the staffing crisis, you also have ones that have left who are not being able to be replaced. And so we are, I think yesterday we actually had a childcare roundtable. It was an early childhood roundtable discussion with a bunch of legislators and our local leadership council. And the YMCA stated that if they were able to run at their capacity with all of their openings, it would be an additional 360 children-ish. And so if you think about that, and many of the childcare providers in the room talked about how they're not able to open their classrooms because there's just not enough staff to operate them. And so there's a lot of factors into them not being able to find staff, the education requirement, the rate of pay. The average rate of pay for many childcare and early learning professionals within our counties, the average is about $10. Some of them are actually making about $7.50.
Yeah, this is real.
Yep.
Yeah,
I know.
One of our local educational institutions opted to not continue with a degree program because people were moving out of college and not getting a livable wage once they were able to use their degree. So all of those factors really have a impact on that overall childcare and early learning where we're at right now. And so what does that do? It creates basically a huge gap where families who are looking for childcare don't have places for their children to go. Oftentimes they're making decision as to where their children are going or whether or not they're being able to take employment or not take employment. The pay structure is very challenging with, the cost of care not being what like the parents are paying. And then, when you add in, you only have 60 days to find a spot if you are part of the subsidy program, and you can't find a spot, then you can't receive the subsidy.
Yeah. So what I hear you saying, economic impact.
There's a huge economic impact. Like childcare is workforce development.
Absolutely.
Investing in childcare is workforce development. Hear me loud and clear.
Put it on a t-shirt, Heather.
Childcare is workforce development.
Put it on a t-shirt.
We're doing it.
Well,
We're doing it. Meghann, I feel like you have a take on this.
Well, yeah, just to touch on that, as part of this roundtable thing, we surveyed our providers, we surveyed families and parents in our area just to kind of get an understanding from both sides of what that was looking like. And some of the data was like glaring. I mean, one of the things I think for me that stuck out the most was we surveyed parents, and one of the questions we asked was, if the childcare you utilize today were to close, do you have a backup plan? 90% of them did not.
No, I don't. I mean,
90%.
No,
so there are no other spots. There are no other spots where there's one. And this year we opted out of it because other extenuating circumstances, but there's only one childcare facility that is close to us, that is within my child's school district area.
Yeah.
Yep. And we actually had, on top of that too, we had a superintendent from one of the school districts in our area speak last night. And we had one of the childcare providers who is in that neighborhood, right? And one of the things he talked about, and he said, I realized how big of an issue this was when that childcare, for whatever reason, one day had to close, right? And he goes, obviously, I know my employees use childcare and stuff, but I didn't realize how many until that day. He said, my phone started ringing off the hook, and the sheer amount of my employees that were not able to come to work for one day because of that one center closing blew his mind. He was like, you really get an understanding for it at that point.
Well, and I think the other thing here with respect to kind of the cost, the livable wage component that I want to point out is that I think it's something that I know, Rachelle, we've talked about in executive leadership discussions, is that when we think about the pay that community action agency employees receive, there's always this kind of internal struggle about, right? Like, how much are we paying at our base salary? How much can we afford to pay at our base salary? And is that really a livable wage? And if our job is to help lift people up into self-sufficiency and beyond, is it the right choice for us to employ folks at this pay scale? Because it feels indirect, competition with that as a value. And so it's a hard thing to figure out and reconcile. But I think, to go back to your point, right? Childcare is a workforce development issue. I can't underscore that enough. I know I was thinking about this in thinking about this episode, I was walking to my kiddos to school. We live about a half a mile away from our school, and I'm thankful for that. But we got a text one morning. We're about halfway to school, and a squirrel had eaten through an electrical line. So school was closed that day. And I was like, I got to get on the road. Like, I'm supposed to be on the other half of the state right now. My wife is already at work. I'm thankful that I work in an organization that if I need to, I can work from home, and I do work from home most days. But if that wasn't the case, I potentially lose my job if I don't get time off. And so what does that mean for me? Because if my kid's supposed to be in school, there's no childcare facility I can just go and drop them off at, right? So I think this is just such a layered challenge across the state. And again, why I think this project is just so innovative, because you've created a real amazing solution.
May I throw a curveball in? Go ahead, Rachelle.
I was just going to say, one of the other points I think that's super important was, we have partnered actually with a researcher at Lycoming College who talked about, basically the students who are going into the field of early education and the pay rate that they'll be getting if they went into pre-K, as opposed to if they went into kindergarten, first, second, third, all the way up to sixth grade. And the pay difference is staggering, right? And so we're paying the least really for kind of our most vulnerable kiddos, right? And so for those the little itsy bitsy babies and the toddlers and up to age 5. And so just that system we have to change somehow, right? And as part of the substitute aid pool program, one of our biggest struggles was really getting providers on board with the fact that we're not going to pay the same rates you are.
Yeah.
Right.
Well, Sorry, no, go ahead. No, go ahead, and then I'll get to my question. I don't want to step on your answer.
I was going to say, like, we use equity salary scale here at STEP. And so we really looked at these positions, the substitute classroom aides, as very similar to the aides that we use in Head Start, even though their job descriptions are different. They were actually categorized the same through that salary study. And so they receive close to $15 an hour at starting wage. And so with many of the childcares, having less as that salary, we got a lot of pushback at first. But we talked about the reasons in terms of they're only working 20 hours a week. It can only be part-time. They're not getting benefits. There's various pieces, the flexibility piece. And so we did definitely get childcares on board to understand. But the real push is that we're not lowering our rates to meet what it is. We're going to be continually trying to push those rates because of the value that these individuals have within these very important jobs.
And that's the one thing, and Heather, I want to make sure to get to your question too, but I want to also talk about for just a second is that to your point, Rachelle, right, that age between, right, kind of start of childcare to right before school and going into school is, right, what is it, 75% of the human brain, right, fully established, right, by the age of 3. 75%. So those things that happen to us, right? Like whether we're left, crying in a crib or crying in a bassinet or a pack and play or whatever, whether or not we're stimulated, how we're stimulated, right? Mentally, right? Those things end up equating to our success in kindergarten. And, I grew up in the 80s. We didn't have, early childhood education in the same way that we have now. But right, we understand more about the human psyche, right? How our brains form now, and so we owe it to our kiddos. School is more complicated earlier than what it was for us, and so it's an important level of education that to your point about the salary, it's in opposition to what needs to be there. Right? There needs to be equity within those positions. So I don't want to harp too much on that as an advocacy point, but I do think that it's really important. Heather, you had a question. I want to make sure that you get a chance to answer.
Yeah, absolutely. First statement, I just want to say thank you, Rachelle and Meghann, for advocating for the childcare workers to have a living wage. And I understand that in this line of work, it's thankless. So if you don't get any gratitude, I want to share it right now. Y'all are doing God's work. You know what I mean? So thank you for pushing that. But did you all see the headline about New Mexico?
Mm-hmm.
Yeah.
New Mexico is the first state to offer free universal childcare for all families starting this November.
Yeah.
Yes.
Like, what
Awesome.
would it?
Amazing.
First of all, what's the reaction on that?
Honestly, 100%. I think that we know, like the research shows, we know what needs to happen, and I think that is absolutely awesome.
I think when we do, Meghann, what would you? I want to make sure you have a chance.
I was just going to say too. I think someone has to take the chance, right? And I think that's almost how we felt about this program too. Like someone has to take the chance and see what happens. So I was really happy to see that. I'm excited to see how it works for them.
Yeah, me too. And I'm curious to see how maybe what you're doing can be influenced by that or vice versa. I mean, you're out there, doing the thing. But Beck, you're going to say something.
Well, I just want to say, like in poverty simulations, which is something that community action agencies do. If you're looking for a poverty simulation, reach out to info@thecaap.org. We're happy to connect you with a local agency who can do that training for you. But in poverty simulations, one of the things in the debriefing process that we talk about is the cost of childcare. And I'm always amazed when I participate in those as a volunteer, what people think childcare actually costs and what I know that my bill has been and or would be. Average childcare costs for a month, you'll hear people say, oh, like $400. And you're like, I don't know where you're sending your kids. I wish.
$1,200.
Right. Like it's a mortgage payment. And that's for one.
Yeah.
Right. You have 2, 3.
Yep.
It's even more. So
like buy 2, get 1? Like
no.
No.
I wish.
That'd be great.
Right. I know. It's like when you take your pets to the vet, you get a discount if you have multiple pets. Can we do that for childcare? Some places do. But yeah, I mean, I just think it is wild what it actually costs and what people think it costs. So do yourself a favor. If you don't know the answer to this, if you don't have kids, good for you. I'm sure your house is much cleaner than mine. But Google Google what it costs. Actually look it up, because I think people will be surprised. And it varies pretty drastically from county to county, but it's not cheap, folks.
And think about that, right? Like, we're saying that childcare isn't cheap, and yet
right,
the cost of doing business, right, and the cost of the staffing, we're still having these wage rates that are so low. And so, which means that something else has to come to play, right? Something else has to come and help support, right? That, whether it's the commercial or the chamber, individual looking at childcare as a benefit to employment, what does that look like? We talk about that often. That should be a whole nother episode. So I'm not going to go down that road, but that's a whole other thing. But there's a lot of pieces within it, in order for basically any community to be able to be thriving, they have to have all the range of options of childcare, right? And that's everything to be able to meet everyone's schedule. It'd be great if everybody had a pop-in childcare location, right? Kind of the private pay, the subsidy pay, that whole range of childcare is what is 100% needed within any community to be able to allow for the workforce, right, to be able to move forward. Or you're just not going to have those families take the jobs within those communities, because the first thing people do when they move to an area is, what do the schools look like?
Yep.
And what is the childcare situation?
Yep. So I want to get into, so we talked a little bit about the how and the why, but I want to talk about really, the what, how this happens on the day-to-day basis. What does the program look like? And so again, Meghann or Rachelle, if you can talk to us a little bit about what really we're talking about, because folks are probably like, okay, substitute aid pool, like, how is this so innovative? We've talked a little bit about some of the pay equity pieces, which are great, but walk us through really like the mechanics of how this works. So
yeah, I can do that. So to just kind of walk you through each of the pieces within the program. So, starting off, right, is the hiring and training of aides. So STEP, we do that. So they are STEP employees. So we hire substitute classroom aides as part-time employees of STEP. So they can work up to 20 hours a week within the pool. Now, as part of that, once they're hired on, they go through an onboarding process with us. So, and I know you said that knowledge piece. So some people know there's a lot that you have to do before you can ever walk in a classroom and work with children. I mean, a laundry list of things that have to be completed. So that's, clearances, CPR trainings, fire safety trainings. You have to have a physical, TB test. You have to have references, high school diploma. So we take them through that onboarding process. We cover the cost for our aides of obtaining any clearances they need, any trainings they need. More importantly, we also pay them for their time while they do that. One of the trainings they complete is a mandated reporter training. That's a 3-hour training. We pay them to do that. So we take them through the onboarding process, complete all the necessary steps that the state requires for someone to work in childcare. And then once that's done, they are available to be an active aide in our pool. So on the provider side, then what we do is we work with providers if they have an interest in enrolling into the pool. They complete an enrollment form, and I basically am just asking them for as much information they can give me about their facility, location, hours, shifts, all of that. And I work with them to enroll into the pool. Now, the pool itself is all ran through a scheduling software. Okay, so all aides, all providers, they get a user profile created in the app. And so that allows our providers to go in and post their shift vacancies. And then it allows our aides to get alerted anytime there's a shift vacancy. It's on an app on their phone. They get a notification. And then what happens is if an aide is like, hey, yeah, that's a shift I want to try to take, they put a claim in for it. All of those claims get directed back to the director of the location. They choose who comes into their facility. They approve the claim for whatever aide they'd like to come in. And then our aide goes out to that location that day, fills in for that shift. And that's like the premise of it, right? So within the software system, pretty much the entire program's ran through it. Everything from communication, trainings, scheduling, timesheets. It houses all their documents in there so that our providers have access to all their clearances and everything if they need it on the spot. We do celebrations in there. We celebrate, birthdays or, anniversaries. We share a lot of information in there. Even, the nice thing about us being the ELRC is there's a lot of professional development and training opportunities. So we're able to share all of that with our aides throughout the pool and our providers in there. Hey, we have a training coming up. It's something your staff would be interested in. So everything runs through the app. Now, as far as the usage, there's no fee for a provider to enroll in the pool. That's completely free. And I do all the legwork. So I set them up. When they go in there, each provider has their own schedule and time clock within the program. So I do all that, set everything up. I then go out to their facility and I give them an orientation on how to use the software program. So there's no fee to just do that. So the only time a provider incurs a fee is for aid usage per hour. So what we do is we charge them per hour to utilize an aid, and then we invoice them monthly for any usage that they have in the pool. Now, some specifics. We pay $14.65 an hour to our aides. Our providers pay us $18 an hour for aid usage. And that is covering, us paying the aid, their wage, and then an administrative fee for their spot in the app. Because we pay for that. It's a subscription. We pay it yearly. And so, that's an administrative fee on top of that. But yeah, it's really simple when you really think of it that way. It's all driven through the app. And I think the technology piece of it is, if not the biggest factor that has made this successful.
I think it's also opened up like a new type of worker.
Yeah.
Right. And so you're kind of like taking that gig worker model, but you're like putting it in childcare. So individuals who like may need a bit more flexibility in their day-to-day life or work, yet they do have maybe an affinity to working with children. And so there's this whole different style of employee that we're getting through the pool that I think has been absolutely incredible to be able to kind of see and be able to foster through the program. And so I think that has been really neat and something that I don't know that we expected. I'm really proud to say that through the program, all the individuals that started and actually went through the orientation are still members of staff in the program today. So
that was going to be
really
some of my follow-up questions around kind of the unintended outcomes, and so I want to get back to that. But roughly, right? How many substitutes are you working with at this point?
I currently have 13 aides that are active in the pool, and we currently have 8 providers with a total of 13 locations that we service.
Nice. And so what I love is that you've built in some of the overhead costs to the service that you're providing so that it can continue to fund the project, right? So that's there. You've been thoughtful about all those pieces. I want to kind of dig into this technology side a little bit, because I think one of the things that we've heard fairly often within human services and within community action is that, there's so much technology innovation that's happening in the world, and there's more AI on top of more AI on top of more AI. And as someone who, affectionately, my office, my team, I get called pop-up because I both love and hate technology and kind of know how to use it most days, and then other days don't. Depends. Heather, one day I'll figure out how to use Canva, I'm sure. But for now, I'm happy with my PowerPoint. Thank you very much. But anyway, so I want to talk a little bit about the technology, because I think where we know we can save administrative costs as organizations is investing in technology. But more often than not, we don't have time to invest in it. And so then it keeps getting kind of pushed, on the back burner. So has there been any particular automation that you've built in within this that has saved you a tremendous amount of time that you can point out? Or something that, eventually you'd like to build in terms of automation? And I know that for our listeners who are outside of Pennsylvania, as Meghann's thinking about the answer to this question, one of the things that is a little tricky for us is that our childcare laws they're some of the toughest in the country. And so there's a lot of layers that Meghann mentioned there that other states don't have. I think us and Massachusetts are kind of like the top 2 highest and above, right, restrictions on who can, how, all of those pieces. But anything within the automation that you want to speak to, or the technology on the whole that's really helped, beyond the scheduling pieces, right?
I mean, I really do think the use of it as a whole, and I think one of the ways is the relationship building, right? That's one of the things we kind of noticed right away, is, subs go out and they'll go to a particular facility a handful of times, right? Maybe. And then the next thing I know, I'm looking in and I'm like, oh, so-and-so has 5 shifts. I didn't see like any pop-ups come in to claim them. And it's because the provider is just working directly with the aide and giving them the shifts because they've been in their facility. There's a chat embedded in it. So they're communicating without me. They're going directly to the source and working with them and putting in. So I think for me, that takes a lot of legwork. You know what I mean? It's like they're kind of, the relationships are forming on their own. The program's running itself really. And to that point, I was hired, as a full-time position for this role. I would say about 7-8 months in, I went to Rachelle and said, I don't have 40 hours worth of work. The program is running.
Good for you lifting it up.
You know what I mean? Like the program is running itself. Like once you're in it and once you're utilizing it, there's very little I do. I mean, I do, all day. It's on my screen. I will tell you that. And we talked about this a little bit earlier. I'm a Virgo. So for me, it's like we're filling every shift and we're doing it right, and I'm a stickler. So I do a lot of oversight in that way. Like, hey, if maybe I can shift some aides around to create more coverage. But I mean, it really does run itself when it comes to just the day-to-day operation of the program. And I think that's been the biggest part of it.
Yeah.
I think just the idea of using this type of scheduling technology to fill shifts is very innovative.
Absolutely.
Particularly in community action and any kind of like nonprofit service. And we're actually taking this model and actually translated it to our part-time transportation drivers. So we operate the shared ride program for multi-county region. And so we often have like these one-off shifts are basically rides to various locations that if we were able to have somebody come in and just do those rides, it would take off the kind of overall burden to the part-time and full-time drivers. So I think we have 3 substitute drivers now that works just like this aid pool program where you have basically the ride that needs to happen and these drivers can come in and pick up shifts. So I think, and it's working really well. And so I think that just the model of the type of employee now that we're getting because we're becoming and utilizing these technology pieces has allowed us and opened up such a different type of workforce, that wants to have coffee and not not do anything until 10 o'clock and wants to be able to be home by 3:30 to be able to go watch a show.
Look, I mean,
sounds awesome, right?
If you have kids, right? And I need to get my kids ready in the morning. I need to get them to school. Like I can't find other employment. There's a gap right in my day. I'm going to get my kids off to school. I'm going to go work. I don't have a backup. Maybe I'm a single parent. And so my kid gets sick. I can choose not to take a job for the day, right? And then best part, I'm home by the time they get home from school because guess what? Childcare desert. I don't have anywhere to send my kids. So then I'm home with them in the afternoon. So it creates a pipeline also for folks who otherwise employment isn't a reality because their time is limited because of who their family is.
Mm-hmm. I do think one other aspect too is the training part, right? So, as part of the onboarding, there's, the 3-hour manager reporter training. They do a 10-hour training on better kid care, all of that. They no longer have to come into a physical building and sit there and someone has to be there. They do it from home. They clock in at home. They complete it on their own time. They clock out. So I think that's an aspect, you can look at when it comes to that as well. It's like, you don't have to worry about housing someone to do a training somewhere and having someone there to do it. They're doing it on their own time at home. And it's worked out really well.
Yeah.
And we've had throughout the time, I think this is something that's really important and kind of just shows how the model is working. 6 aides have been hired out of the pool, 2 childcares.
That's
they have all asked to stay in the pool.
Yeah.
Oh my, okay, there's the twist that I wasn't expecting. I've been sitting on the edge of my seat like,
that was going to come up as one of my unexpected outcomes.
Yeah, I was going to say, are they getting hired then?
Mm-hmm.
But they're like, no, I don't want to go. That's
no, they do. They do.
Oh, they do.
Oh, they do go.
They do go, but then they still stay in the pool for when they're not working.
In the pool. So let's say they get hired on at a after school program, right? They're only working 3 to 6. But if a preschool needs a 9 to 1 shift filled, they can go do it,
This is amazing.
Yeah.
This is amazing.
So I think that one of the things that I will point out about kind of like the automation piece and just the technology piece, that for our folks who are within human services, you got to really think about technology in a couple different ways. And I think this program is also representative of something that we've talked about, Rachelle, in terms of the healthcare partnerships that exist across the state, right? This program is within the framework of what you already do. It's not a new program, right? It's simply elevating capability and has direct economic impact on the local community that you're trying to serve, right? It addresses a community need. And so it's within the framework. And that's really important, because a lot of times when we will talk about things like this, people are like, I can't take on a new program. I don't have the capacity. But, right, all of these unintended outcomes and benefits back to the community, I would argue it creates other solutions along the way that it's worth the investment of time in terms of looking at it. And I think the other thing is that sometimes we're really good at, and I don't mean this about community action, I mean this on the whole, when we work within this field, is that we really are good at thinking about, okay, what's the needs of our community? But then we forget about the framework in which I exist as someone who's struggling to make ends meet. And so I think when I think about kind of what this represents for individuals, for scheduling, right, I also think about it in terms of like direct client work. And if I need to make a phone call to an office and I'm working at a job that I can't take time off, I don't really get a lunchtime, right? And I need to make a call to get a need met, how automation can be built into helping that person after hours, right? And or scheduling an appointment so that I don't have to sit on a phone call waiting to figure out how to schedule a phone call. This type of automation, I think, is part of what really becomes hypercritical to helping human services become more administratively less burdensome, right? And ultimately helping more people. Because if you've sat on the phone to call the county assistance office ever, which I absolutely have, 6-hour waiting time, that's not real. Now, luckily, thanks to DHS, right, they've implemented the callback feature, but, who has time to sit on hold for however long? It's wild. And or yes. I just can't simply get to the phone to make a phone call because I just have other things, competing priorities.
Yes. Next podcast, we talk about Find My Ride.
Yes. Yeah. Well, seriously. Yeah. Well, hold me accountable to that. Our editor out there, Amy, shout out to Amy, to all the listeners, because Amy's remarkable, but Amy will hold us accountable to making sure to get that scheduled.
Yes, she will. I bet you she already put that as a task in Asana.
I was going to say our project management software that we are working on a regular basis. So a couple more questions that I want to make sure to ask, and I want to be respectful of your all's time. I know you're very busy people. Anything else that's been really surprising about this project or other unintended outcomes that you want to make sure to lift up? Because I'm sure that there have probably been more than what we've touched on.
I mean, just to elaborate on that aspect of the employees, it's the loyalty to the program that really shocked me, right? I mean, 0 turnover so far with aides that have, completely went through onboarding and have been in a facility. And, like I said, the fact that they'll get hired on and they'll look right at that director and say, we're still going to be an active member in the pool in case we can help somewhere else, as well. I think too, and I think a lot of that has to do with, because this was something completely new, no one's ever done in our area. A really important part of this was transparency for us with people, both providers and people we're hiring. Because one of the first things when someone applies, I do a phone screening, right? And one of the first questions I ask is, I can't guarantee you hours. Are you okay with that? right? Like, and I explained to them, like, you're looking at us like a side hustle, an Uber, like a DoorDash, right? Like, this is meant to like be a supplement to income. It's not something you can live off of due to some of the parameters we have in it, but it is intended to allow you to help when you can help and where you can help. Right. So, and they're all like, yeah, and then when we get in there, especially in the beginning, like my first couple aides that I hired on, because when we first started, I started with 3 kind of right away. They really did the work for the first few months. And then, we added a few more. And I think I was at about 6 aides for almost right before summer. We had 6 aides. And to give you some context, those 6 aides up until summer all worked about almost 300 shifts, the 6 of them, which was awesome. And that's the thing too, they're really good about communicating with me, and they're open with me, like at facilities, like, hey, like we're kind of seeing this. And it's nice because then I can go back to the directors we work with, like, hey, here's some feedback I've been getting, right? And they're in there. The director might not be in those rooms all the time and we know they don't have the time to keep an eye on everything, right? So I think that's been a really neat outcome as well, is that, the value that our aides being in these buildings can provide even to the directors, just from a standpoint of like processes, procedures, what they're seeing, and being able to share that with them, an extra set of eyes, I think is big. But yeah, I think the loyalty to the program is really what's shocked me. But I do think it's because, I also stress that this is a team effort, right? And especially now, like I get to share with them this kind. I'm like, hey guys, we're doing a podcast. Hey, we're going to be at the CAAP conference this year. Like we did that. Like the providers that took the chance and joined this program and trusted us with it, and the aides that have hung on with us. I mean, there's holiday break. There was no shifts, and they, you know what I mean? And they stuck it out with us. So I really do stress that this is a team effort. The amount of success we have is because everyone involved in this, was willing to work for the greater good. So I think that's been a really neat outcome.
I mean, and I think I've said this to you, Rachelle, and if I haven't, I'm saying it now on a recorded line, no less, is that I would love to see this grow to be a statewide program, right? Like there's an opportunity.
100%.
There's an opportunity here that, hopefully a year from now we come back and we celebrate the fact that we've made that happen. So just
that's the goal.
Here to say that that's the dream really here.
That was our goal a month after I got hired, honestly, because and here's why, Rachelle said, hey, there's sub pools around here. And I go, okay, I'm going to go find them. I couldn't find a one, especially in Pennsylvania to this extent. And really the one that I found that it probably is the closest to kind of how we do this is Washington State, and the state runs it, same setup as us. And I looked at her, I go, that's the end goal now.
Seriously.
We know it's possible. People, other states are doing it.
Making history in the state of Pennsylvania with these. I was going to curse, but I can't curse. These amazing women.
I mean, like we've already given the recipe, right? Yeah, we've already given the recipe to others, right? Yeah. Lancaster CAAP.
They are operational. I got a gift basket a month ago. I met with the Community Action Partnership of Lancaster County. I met with them in February and gave them the rundown. I mean, I gave them everything. I'm like, whatever you need, documents, processes, procedures. I met with them multiple times. We talked through, here's our referral link for the software. We'd like the discount, and all of it. And I got a gift basket last month, and I'm looking at the card right now, and it says, we just want you to know we hired our first aide. And we never would have been able to do it at this speed without you being so free with the information and sharing it with us. So,
well, look, that's the beauty of community action, right? We help each other. Yes. It's a giant family. We're just trying to help make our communities grow in lots of ways and share successes. I think that's one of the things that was really, surprising was that I sort of anticipated, right, coming into this role that there would be a sense of competition. And I don't feel that, right? Everybody's so willing to help one another, and where one stops, one is willing to pick up, and vice versa. And it's a beautiful thing to watch. So I appreciate you all being a part of that and helping Lancaster CAAP get it started.
Yep.
Is this now? I know that I'm sure this episode is going to go out after the conference, I think.
Yeah.
But is this a breakout session? Are you teaching at conference?
It is. We are.
Oh, and I was going to say, because if it's not, we're missing something. All right.
Yep.
But don't worry, because I have, and Rachelle and I have a meeting that we're trying to schedule right now. I have some ideas about, other opportunities to continue to grow this across the country. So, more to come from my big idea brain that can't stop working 24 hours.
And when you bring my big idea brain and his big idea brain together, then it's just like the worlds collide and
wild things happen.
Fun fact, something else Rachelle and I have in common is I'm the same way. So, it works out well for us. It's a good
Look, I've said this before on prior podcasts when, ideation and strategy are two of your top strengths. It is a secret sauce. I think it's part of what creates unicorn employees. So if you're out there and listening, folks, and you do strength finders as a part of your onboarding process and you find somebody that has those two skill sets, I would say invest in them because they will get things done in a way that is at a wild pace and in remarkable ways.
Yes, and I would say that Meghann has done that for this program, 100%.
4 months,
right? Because I was like,
4 months it took us to get it
about a year. It'll take about a year for this, and she got it done in a matter of months. And it was like, here you go, and it was like awesome. So,
in my defense, they stuck me in a room by myself. They're like, here's your office, here's your desk. Some of your teammates will be moving in here in a while. We're getting ready to do that. And I'm like, well, I'm in here by myself. What else do I do? So I think that helped.
Yeah.
So if folks are listening and you're trying to get connected to STEP, you can, of course, go to the CAAP.org and look for STEP on our members page, or you can email info@thecaap.org. We're happy to connect you to Rachelle and Meghann. If you're interested in becoming a part of the pool and or a partner. Specifically, STEP serves Lycoming and Clinton counties, and I think a part of this program also Tioga, if I'm not mistaken.
Mm-hmm. Yeah, we're rolling it out to the other two counties. We're working on some funding pieces. Right now, it's just in Lycoming, so Clinton and Tioga. We are focusing on expanding because we have the providers and the people, but we just need some of that local investment.
Cool. So more to come for the other counties, but if you're specifically in Lycoming County, right, and you're looking to be a part of the pool, again, reach out to us. We're happy to connect you. If you're organization looking to partner, let us know. Anything else that you all want to share in terms of things coming? We'll talk about the RIDE program in a future episode, I think, if I'm not mistaken. But anything else you all want to share with respect to this project and something that's top of mind that you're like, listeners need to know this?
To give you some context, as of the end of August, this past month, as of August 31st, so 10 and a half months in the pool, we had a total of 485 shifts that have been posted into the pool. And we've filled 423 of them. So we average about an 87% fill rate. I mean, we've had, I think the month of July, we hit 99. We've had some in the high 90s. So it's working. It is successful in the terms of when you look at the data, right? We're making a huge impact with it.
I think the biggest thing is this is just the beginning. Yeah. And so, this is just the beginning. It's about a year.
1 year anniversary, almost a month to the day. Yep. October 14th.
To the year. So
we launched it.
Let's talk again in a year. Let's see where we're at, and just really excited to be able to have the conversation. Childcare and early learning are workforce pieces that we just need to keep pushing. And this is one of the many programs that need to kind of come together to allow that to be reality of how we address this issue across our communities.
Absolutely. Thank you both for coming on. I know that we've kept you past our time, I think, at this point, but I appreciate digging into this project. If folks have specific questions that you want us to get answers to, happy to also facilitate that. So again, email us. Thank you so much, my fearless co-host, Heather.
Oh, this was a wonderful conversation. Congratulations, ladies. Thank you again for taking care of our Pennsylvania residents, our children. This work is so important. And for those listeners out there, listen up. Take a beat. Take a play from their playbook, right? Reach out to them.
We're happy to share.
We're happy to share. Let's see if we can't sweep this across the whole state. So well done, ladies. Well done.
Thank you. Thank you for your time as well.
Thank you so much.
Drawing attention to this. We appreciate it.
Of course, the first time I heard about it, I was like, Rachelle, we need to make sure, like, I don't know how, but we're going to figure this out. I think it was pre-podcast era, and now we're in podcast. So, like, we're continuing to grow too, to lift up the message of community action. But ultimately, I think for our listeners, I think want to make sure to share, right? Like, these types of program experiences, if you're doing something incredibly innovative, this is part of what we really wanted to drive to the podcast, to lift up to the network as a means to grow and learn our organizations. And so, perfect example of something that really this podcast was intended to talk about. So happy to do it. Happy to spend time with everybody. And thanks to all of our listeners for putting on your thinking cap. Catch you the next time.
Bye.
Thank you so much.
Bye.
Thank you for being a part of this episode of the Thinking CAAP. Check the show notes for resources and links to other episodes. And don't forget to subscribe and follow to be notified when new episodes are released. If you have any community action questions you'd like Beck or one of our local experts to answer in a future episode, please email your questions about community action to info@thecaap.org. Subject line, Thinking CAAP.